Hi, Dr. Brian Heaberlin here with Lexington ENT and Allergy. I want to talk about allergies some more. I've done other videos where I've went over allergies and just wanted to talk about the fact that ragweed is high currently. So the typical march of allergies through the year are in the spring of the year, early spring, people have more tree pollen allergies. And then as we lead into the mid portions of the summer, people are more affected by grass pollen allergies, and grass pollen can be particularly bad here in South Carolina. And then in this portion of the year, we're really starting to see ragweed be very high. So ragweed pollen and really all the other weeds pollinate basically at the same time as ragweed. So if someone gets testing, we may not find ragweed to be so high, but we can find other weeds such as pigweed or sheep sorrel. There's a lot of weeds that are out there. Goldenrod, these are some lay terms for different plants that pollinate in the fall. And so ragweed's high right now. Common symptoms are going to be itchy, watery eyes, nasal congestion, sneezing, postnasal drainage, clear watery drainage through the nose. And sometimes that inflammation can cause the sinuses to become obstructed, which can lead to sinusitis as kind of a downstream problem from allergies being sort of more of the root cause of that. So allergies don't truly cause sinusitis, but it can definitely be a factor in someone developing chronic sinusitis from the swelling that can occur from the allergic inflammation. So what can you do if you have allergies? Well, there's common over-the-counter medications that people can take, such as Claritin, Zyrtec, Allegra, or the generic versions of those. So those are daily pills that people take. They're not nearly as sedating as the old-fashioned antihistamines, such as Benadryl, and most people take those and tolerate them very, very well. Nasal steroids are also very, very helpful. So Flonase or fluticasone or some of the generic or brand name other versions such as Nasacort or Rhinocort can really help improve people's symptoms. Now those do take a little time to become effective, so when you first start on out on a nasal steroid spray, give it a week or two before you're really going to know what it'll do. The nasal steroids tend to help congestion a little more so than the antihistamines. Behind the counter, but still without a prescription, you can get antihistamine decongestant combinations such as Claritin D, and all these is a oral decongestant like Sudafed along with an antihistamine. The decongestant help constrict some of the blood vessels in the nose, which can give you more breathing room. So they really adding in a D helps improve the nasal breathing. Now the downside to those Ds are that people will sometimes be nervous, anxious, jittery, or have trouble sleeping. It can make your heart race or skip beats. It can cause men to have prostate swelling. So those are some of the issues that make decongestants not a good idea for most people. But if you're 25 or 30 and you're in great health, those may be a really good option to help improve your breathing, especially during the problematic parts of the year. Now, if you're always bothered by chronic stuffiness and you can't ever breathe through your nose, you should be evaluated because you could have polyps or you could have a bad deviated septum or other more correctable kind of things. But for the allergies, there's now some really good allergy eye drops that are available. There's one called olopatadine or Pataday, which is a daily eye drop. And then there's several others that are, different topical antihistamines that can really help relieve the itchy, watery eyes. Now we don't like Visine or other pure Visine or things that have a vasoconstrictor in them because it can just cause rebound swelling or redness. Similarly, we don't like folks to use nasal decongestant sprays such as Afrin because people get rebound swelling and then they can't breathe unless they're using those things regularly. It's okay to use those things just for a few days around an upper respiratory infection or cold, but not something that we want or that anyone should use chronically. Otherwise, there's another video I've done about how to get off of those sprays or try to treat that. So if you're suffering with allergy problems now, good chance it's ragweed. Now there's also the perennial allergies. These means the things that are happening all the time, all year round, such as dust mites or pet dander or molds that could be giving you problems as well. If you have symptoms that aren't managed well with just simple medications, it's a good idea to be evaluated by an otolaryngologist or a general allergist and having some allergy testing done so you can find out exactly what you're allergic to. It doesn't make a ton of sense to spend a fortune on dust mite allergy mitigation methods if you're not allergic to dust mites. So allergy testing is helpful certainly if we're going to consider allergy shots, but it's also helpful in just knowing what to treat and what environmental controls are important for the person tailored to their specific allergies. Just some general information. I hope that helps. We're happy to take care of any issues you have with allergies here at Lexington ENT and Allergy. Thank you.